Live from Center City in Philadelphia, this is Fox 29 News at 10.
Eat healthier, work out, and make regular trips to the doctor. Yeah, they're all recommendations that we know are positive, but sometimes can also cost more than we can afford. But one hospital is hoping a new program will mean people won't have to choose between buying the food or seeing a doctor. For goodness sake, here's Bill Anderson.
All right, so maybe you're one of them, maybe you're not. But we all have to admit, in too many communities, just getting people to go to the doctor, it's become a huge problem.
I told the doctor my anxiety was really high because, you know, I'm trying to make ends meet.
And then, if you actually get people to go, depending on your insurance, the cost of treatment and preventative care, that can be another problem.
The money's not really there. So what suffers is the food. You all of a sudden start buying less food.
I met Libby Chapman at the ribbon cutting of a new program. She was brave enough to share her uncomfortable financial situation with me.
I never thought I would be in this position.
But Libby isn't that different than many forced to choose between needed medical care and just having money to eat.
Kale is the #1 thing to leave us.
She's one example of the reason for medical facilities like the one I attended opening on-site food pantries.
We designed this program as a food as medicine approach to help patients who are experiencing hunger and chronic disease.
The program launched at Virtua Health in Mount Holly is a way for patients like Libby to not have to glaze over, honestly, when doctors suggest a healthier lifestyle because they already know they can't afford it.
It has lessened my anxiety because I know the food is here. And I have somebody looking out for me.
Shelf-stable protein items.
The hope is that the way Virtua is doing it, incorporating healthy eating into part of the actual treatment, will allow more people to get help without having to embarrass themselves or actively seek it, something we know many won't do.
Because patients are now being asked by their primary care physician and in the emergency department if hunger is an issue. If a patient says yes, they worry about having enough food to eat 3 meals a day. They get referred to this program.
They then get to come to the pantry, get info on available programs, and leave with free bags of healthy groceries.
I'm saving about $200 to $250 a month by being able to come here. And that's another bill, you know, that you have to pay.
The program in Mount Holly has already helped nearly 200 people in weeks, and they weren't even officially open.
But even over here,
Hopefully the idea spreads so that people can actually afford to follow doctors' orders to eat and live healthier, for goodness sake. I'm Bill Anderson.